The Murray State program began in 1999, and to date we have launched the careers of over 180 registered dietitians who work in a variety of settings, such as research, clinical dietetics, sports, and the community setting. The Murray State program accepts a maximum of 12 students each year. Our program runs from June to May, and our concentration is medical nutrition therapy. During the summer months, interns are required to take an online graduate writing course in June, and in July, you will have an online professional practice primer course that will begin to prepare you for your clinical rotations. These courses provide a great foundation before you start your practical experience. Your hands-on training at supervised practice sites will begin in August. We provide supervised training experiences along with the following rotations: the community setting, management practice dietetics or food service management, medical nutrition therapy, and long-term care. These experiences help prepare you for your final rotation of your internship, advanced practice or staff relief, where you will have minimal supervision and function as an entry-level dietitian. Our program is fast-paced with heavy clinical assignments and exposure.
And they provide an outstanding curriculum. It's very detailed, it's very organized, so we know where we stand, and they hand over the intern to us in our capable hands, and they're there to support us, the preceptor, and to support the intern.
We take that classroom theories, that classroom knowledge, and we turn that into real world experiences, and where they can really do some good application that they can carry forward through the rest of their career. Some of the things that we do here is we have what's called a special meal, where they come through and they develop their own meal, and then they see that from beginning to end, everywhere from the ordering of the food to the whole management process.
And they also meet with patients on an inpatient basis. They go into acute care and they spend several minutes obtaining their food preferences, finding out what they normally eat, what they normally drink, if they have any food allergies, are there any cultural or religious food preferences that they have.
They look at what's called test trays and performance improvement monitors. So some of the things that we look at specifically is if we are a patient upstairs, how is the quality of the food items that we are looking at? How is the temperature of that meal item when it is received by the patient? We do several performance improvement monitors, which our interns are involved in, and in doing those, they are actually collecting the data, they are analyzing the data, and then they will be presenting the data to our staff.
I think another one is when they come into an outpatient setting and they sit down with the registered dietitian and they counsel one-on-one with a patient. So for example, a patient may be coming to see me for type 2 diabetes, and they need to learn how to do carb counting. And so the intern will actually take the lead in the counseling session. So I put them behind the desk and say, this patient is yours.
During my community rotation, I worked at the New Albany, Indiana WIC clinic, working with women and infant nutrition, teaching lactation classes, and also working at cooking demonstrations at the local farmers market.
I was able to spend a lot of time with our food service director at the facility to learn how a dietitian can really step into the role of food service and make a difference in regard to patient experience, to raise patient satisfaction scores, to make the food better and healthier. So I really saw a lot of room that a dietitian can have to make changes within the food service world, which is why I fell in love with it.
During the management practice rotation, each intern works at an individual food service location, is in charge of a specialty meal, and gets to serve as a manager of the kitchen for a week. During your advanced practice rotations, you should be working with minimal supervision from your preceptors, almost independently in all the different areas of your hospital, whether that's interdisciplinary rounds, working in the ICUs, or just inpatient floors.
We have clinical training sites throughout the state of Kentucky and in Jackson, Tennessee. Our sites vary from large training hospitals in urban cities of Kentucky and Tennessee to smaller sites in suburban and rural areas of Kentucky. Therefore, we are able to offer you options in terms of the size of the community where you may be most interested in living for the 11 months of our program.
I completed my training at Jewish Hospital. Jewish is a 462-bed large teaching hospital located in downtown Louisville, Kentucky. In my time at Jewish Hospital, I was involved with the cardiovascular, medical, and surgical ICUs. I got to work at the Traeger Transplant Center, as well as study with Dr. McClave, the lead author of the Aspen Guidelines.
My practice site was Lourdes Hospital. Lourdes is a 359-bed facility in Paducah, Kentucky. And Lourdes is a part of the Mercy Health System, and they offer a critical care unit, intensive care unit. They offer an acute care, inpatient rehab. You have the ability to see an open heart surgery right there in the OR. And there's many health professionals, in addition to the dietitians, that are dedicated to making your experience the best.
I completed my dietetic internship through Baptist Health Madisonville. It's a smaller hospital located in Madisonville, Kentucky. At the hospital, I was able to be a part of the dietetics team within the ICU, up on the floors, down in the kitchen.
This not only included working at Jewish, working with cardiac, diabetic, and GI patients. It also involved going to different hospitals like St. Mary's in Elizabeth, where I got to experience bariatric surgery, as well as the University of Louisville Hospital that has a NICU.
Over 80 different preceptors are used in the Murray State Internship. These preceptors include some of the most highly skilled dietitians in Kentucky and Tennessee. Many of them have advanced practice or specialist credentials, such as Certified Nutrition Support Clinician, Certified Diabetes Educators, Certified Lactation Counselor, and Certified Specialists in Renal Nutrition, just to name a few. Many graduates of our program receive jobs from where they completed their training or remain in the area and become preceptors for the Murray State program. To reach your goal of becoming a registered dietitian, you do have to pass the National RD Credentialing Exam. To prepare you for this exam, we provide a review course at the end of the internship.
And those that have completed that prep course, they have a 98% pass rate. They complete 22 credit hours for their graduate, for their master's degree. And those 22 credit hours, they come from homework, projects, assignments, and hands-on experiences in the rotations. Interns have the opportunity to finish their master's degree after taking and passing the RD exam.
The qualities we look for in an applicant to our internship are also skills that will make you a successful intern. These include strong time management skills, flexible and adaptable in all situations, strong communication skills, mature with good leadership qualities, and good stress management skills. Tips for being a successful DI candidate include a GPA of 3 or higher, GRE scores of 145 or higher, a minimum of 4 on writing, documented leadership skills, experience in the field that make you stand out from others, strong references documenting your strengths and abilities, your work ethic and competence, diverse backgrounds and variety of experiences, and strong personal statement including why you would be a good fit for Murray State. We do participate in diecast and D&D digital for the spring match only. Feedback from prior interns are a testament to the quality of the Murray State internship. A few comments from previous interns who have completed our program within the last few years include, I cannot count how many times the dietitians I currently work with have said that they feel like my internship taught me more than theirs did. I hope the new class of interns know how good of a program they are part of. I was provided a positive outside view of dietetics with updated information, practices, and research that many of my current RD colleagues were unaware of. For additional information, please visit our website at murraystate.edu and search for Dietetic Internship. For excellence in dietetics education, let the Murray State Dietetic Internship be the next step in your goal to becoming a registered dietitian.